Hi, today we will go talk about inflammation, inflammatory disorder, and wound healing. Introduction. Inflammation allows inflammatory cell, plasma protein, for example, complement, and fluid to exist, blood vessel, and enter the interstitial space, divided into acute and chronic inflammation. Acute inflammation is basic principles, characterized by the presence of edema and neutrophil in tissue. Arise in response to infection, to eliminate pathogen, or tissue necrosis to clear necrotic debris. Immediate response with limited specificity is innate immunity. Mediators of acute inflammation is very important for step 1 and also 2. Toll-like receptors present on cell of the innate immune system, macrophages and dendritic cell activated by pathogen-associated molecular pattern that are commonly shared by microbes. CD14 or co-receptor for uh, toll-like receptor 4 on macrophages recognize lipopolysaccharide BAMP on the outer membrane of gram-negative bacteria. Toll-like receptor activation results in upregulation of the NF-kappa B, a nuclear transcription factor that activates immune response genes, leading to production of multiple immune mediators. Toll-like receptors are also present on cells of adaptive immunity. For example, lymphocytes and hins play an important role in mediated chronic inflammation. Arachidonic acid metabolites. Arachidonic acid is released from the phospholipid cell membrane by phospholipase A2 and then acted upon by cyclooxygenase or 5-lipoxygenase. Cyclooxygenase produce prostaglandins, prostaglandin E2, prostaglandin D2, and prostaglandin E2. Mediate vasodilation and increase vascular permeability. Prostaglandin E2 also mediates pain and fever. 5-lipoxygenase produce leukotrienes. Leukotriene B4 attracts and activates neutrophil, and leukotriene C4, D4, and E4 slow reacting substances of anaphylaxis mediate vasoconstriction, bronchospasm, and increase vascular permeability. Mast cell vitally distributed through connective tissue, activated by tissue trauma, complement protein C3A and C5A, or cross-linked of cell surface immunoglobulin E by antigen. Immediate response involves release of preformed histamine granules, which mediate vasodilation of arterioles and increase vascular permeability. Delayed response involves production of arachidonic acid metabolites, particularly leukotrienes. Complement is pro-inflammatory serum proteins that complement inflammation. Circulate as inactive precursors, and activation occur via classic pathway. C1 binds to immunoglobulin G or immunoglobulin M that is bound to antigen. And alternative pathway. Microbial products directly activate complement. Mannose-binding lectin pathway. Mannose-binding lectin binds to mannose on microorganisms and activates complement. All pathways result in production of C3 convertase, mediates the conversion C3 complements to C3A and C3B, which is turn produce C5 convertase, mediates C5 to convert to C5A and C5b. C5b complex, which with C6 and C9 to form the membrane and egg complex. C3A and C5A is anaphylatoxins triggers mast cell granulation, result in histamine-mediated vasodilation and increased vascular permeability. C5A is chemotactic for neutrophils, and C3B is opsonin for phagocytosis. membrane attack complex slices the microbe by creating a hole in cell membrane. A Hageman factor is factor 12. Inactivates pro-inflammatory protein produced in liver, activated upon exposure to subendothelial or tissue collagen, in turn activates coagulation and fibrinolytic system. Complement and kinin system. Kinin cleaves high molecular weight kininogen to bradykinin, which mediates vasodilation and increased vascular permeability, similar to histamine as well as pain. Thank you.